During a functional assessment, an RBT observes that a child frequently engages in hand biting when given a difficult task. What is the most likely function of this behavior? A. Escape/avoidance. B. Attention seeking. C. Sensory/automatic. D. Tangible access. Answer A. Escape-maintained behaviors occur when a child engages in behavior to avoid or terminate a task. Since the hand biting happens during a difficult task, it suggests an escape function. What is the primary purpose of conducting a preference assessment? A. To identify reinforcers that motivate the client. B. To diagnose a client's developmental disorder. C. To evaluate a client's problem behaviors. D. To determine a client's skill deficits. Answer A. A preference assessment helps identify stimuli that may serve as effective reinforcers, which is crucial for behavior intervention plans. Which type of assessment involves presenting 2 items at a time and asking the client to choose one? A. Multiple stimulus without replacement, MSWO. B. Paired stimulus assessment. C. Free operant observation. D. Single stimulus assessment. Answer B. A paired stimulus, forced choice, assessment presents 2 items at a time to determine the client's strongest preferences. Which of the following is a direct assessment method? A. Functional analysis. B. Parent interview. C. Questionnaire. D. Records review. Answer A. Direct assessments involve direct observation of behavior in real time, while interviews and questionnaires are indirect methods. If an RBT is asked to conduct a multiple stimulus without replacement, MSWO, assessment, what is the correct procedure? A. Present all items at once, allow the client to pick one, then remove it from the set. B. Present one item at a time and measure response duration. C. Allow the client free access to all items for 5 minutes. D. Give the client a choice between 2 items at a time. Answer A. In MSWO, the chosen item is removed from future trials, helping to rank order preferences. What is the main advantage of a free operant preference assessment? A. It does not require direct observation. B. It allows clients to freely interact with multiple stimuli. C. It is more structured than paired stimulus assessments. D. It ensures equal preference for all items. Answer B. Free operant assessments let clients engage with available items without restrictions, reducing potential avoidance behavior. What is a major drawback of using an indirect assessment? A. It requires direct observation of behavior. B. It may be subjective and based on recall bias. C. It provides the most accurate measure of behavior. D. It is too difficult to implement. Answer B. Indirect assessments rely on reports from caregivers or self-reports, which may be biased or inaccurate. What does an ABC data collection focus on? A. The frequency of a behavior. B. The function of a behavior. C. The antecedent, behavior, and consequence of a behavior. D. The latency between behavior and reinforcement. Answer C. ABC data helps determine patterns of behavior by analyzing triggers, antecedents, the behavior itself, and the following consequences. An RBT is asked to conduct a skill assessment. What is the primary focus? A. Identifying problem behaviors. B. Measuring baseline behavior rates. C. Determining the client's current abilities. D. Conducting a reinforcer assessment. Answer C. Skill assessments determine what the client can currently do and help create appropriate learning goals. Which assessment method involves systematically manipulating environmental variables to identify a behavior's function? A. Functional behavior assessment. B. Functional analysis. C. Preference assessment. D. ABC data collection. Answer B. A functional analysis directly tests different conditions, e.g., attention, escape, to identify which factors reinforce a behavior. What is a major limitation of ABC data collection? A. It does not record antecedents or consequences. B. It cannot be used to determine behavior functions. C. It only provides correlational data, not causal relationships. D. It is too structured for clinical settings. Answer: C. ABC data can show patterns but does not confirm cause and effect relationships between stimuli and behaviors. What is the primary goal of a functional behavior assessment, FBA? A. To diagnose autism spectrum disorder. B. To identify the function of challenging behaviors. C. To implement a treatment plan immediately. D. To determine a child's cognitive ability. Answer: B. An FBA helps determine why a behavior occurs, which guides effective interventions. What is the best example of an antecedent intervention? A. Providing reinforcement after desired behavior. B. Teaching the child a replacement behavior. C. Modifying the environment to prevent problem behavior. D. Ignoring all problem behavior. Answer: C. Antecedent interventions change environmental factors before behavior occurs to prevent challenging behaviors. In a functional analysis, what does the escape condition test? A. Whether the client is reinforced by tangible items. B. If the client engages in behavior to avoid or escape tasks. C. Whether the behavior occurs in response to social attention. D. If automatic reinforcement is maintaining the behavior. Answer: B. The escape condition assesses if a behavior is maintained by avoiding or escaping tasks. When conducting a preference assessment, why should the RBT present items in a randomized order? A. To make the task easier for the client. B. To avoid position bias and ensure reliable results. C. To ensure that all stimuli are used equally. D. To reduce the need for reinforcement. Answer: B. Randomizing items prevents bias toward one side and ensures accurate results. What type of assessment relies on reviewing previous client records and reports? A. Direct observation. B. Functional analysis. C. Indirect assessment. D. Skill-based assessment. Answer: C. Indirect assessments include record reviews and interviews rather than direct observation. What is the main goal of a reinforcer assessment? A. To identify skills a client needs to learn. B. To determine which items increase the likelihood of behavior. C. To eliminate problem behaviors entirely. D. To reduce the need for reinforcement over time. Answer: B. A reinforcer assessment determines which stimuli effectively strengthen behavior. If an RBT records how long it takes for a client to begin a requested task, what measurement is being used? A. Latency. B. Duration. C. Rate. D. Frequency. Answer: A. Latency measures the time between a stimulus, request, and response, task initiation. What should an RBT do if they suspect an assessment is inaccurate due to inconsistent data collection? A. Continue as instructed. B. Modify the assessment independently. C. Report concerns to the supervising BCBA. D. Stop data collection completely. Answer: C. The RBT should report inconsistencies to the BCBA, who can adjust the assessment as needed. Which of the following assessments would be best for measuring social skills? A. Functional analysis. B. Vineland Adaptive Behavior Scale. C. Paired Stimulus Preference Assessment. D. Multiple stimulus without replacement. Answer: B. The Vineland scale assesses social, adaptive, and communication skills. What is the primary difference between a skill acquisition assessment and a behavior assessment? A. A skill acquisition assessment focuses on identifying reinforcement, while a behavior assessment focuses on punishment strategies. B. A skill acquisition assessment evaluates what a client can already do, while a behavior assessment determines the function of problematic behaviors. C. A skill acquisition assessment identifies problem behaviors, while a behavior assessment measures progress in learning new skills. D. A skill acquisition assessment is only used for adults, while a behavior assessment is only used for children. Answer: B. A skill acquisition assessment determines the client's current abilities, while a behavior assessment identifies the reasons behind problem behaviors. When conducting ABC data collection, what should the RBT avoid? A. Recording only behaviors that seem severe. B. Objectively documenting antecedents, behaviors, and consequences. C. Taking note of environmental variables that could impact behavior. D. Collecting data across multiple situations and times of the day. Answer: A. RBTs must record all observed behaviors, not just severe ones, to gain a full understanding of patterns. What is the best way to test a client's ability to generalize a skill? A. Have the client repeat the skill only in therapy sessions. B. Teach the skill in multiple settings with different people and materials. C. Use the same prompt every time the skill is taught. D. Ensure the skill is reinforced only in one environment. Answer: B. Generalization occurs when a skill is demonstrated across different settings, people, and materials. What is a major ethical consideration when conducting a preference assessment? A. Forcing the client to choose a reinforcer. B. Ensuring the reinforcers are age-appropriate and culturally relevant. C. Ignoring the client's nonverbal preferences. D. Only assessing reinforcers that the RBT personally approves of. Answer: B. Reinforcers should be appropriate and relevant to the client's developmental and cultural background. What should an RBT do if a child refuses to participate in a preference assessment? A. Force the child to complete the assessment. B. Skip the assessment entirely. C. Assume the child has no preferences. D. Modify the assessment to accommodate the child's comfort. Answer: D. The assessment should be adapted to meet the child's needs while ensuring participation remains voluntary. What is the best method to assess whether a child understands verbal instructions? A. Use a reinforcer assessment. B. Conduct a receptive language assessment. C. Perform a functional behavior assessment. D. Implement a differential reinforcement procedure. Answer: B. A receptive language assessment evaluates a child's ability to understand and respond to spoken instructions. What does a multiple stimulus with replacement (MSW) preference assessment involve? A. Allowing the client to pick from an array of items, removing chosen items from future trials. B. Presenting a single item at a time and recording duration of interaction. C. Letting the client choose an item, then placing it back into the array for the next trial. D. Giving the client a forced choice between two items at a time. Answer: C. MSW involves placing the chosen item back into the array, allowing for repeated selections. How can an RBT best determine if a behavior intervention plan is effective? A. By asking the client if they like the intervention. B. By monitoring changes in behavior using data collection methods. C. By assuming a reduction in problem behavior means success. D. By modifying the plan without consulting the BCBA. Answer: B. Continuous data collection helps assess whether an intervention is achieving its intended goals. Which type of behavior assessment relies on directly manipulating antecedents and consequences? A. Functional analysis. B. ABC data collection. C. Indirect interview. D. Preference assessment. Answer: A. A functional analysis systematically alters antecedents and consequences to determine what maintains a behavior. What should an RBT do if they notice a discrepancy in the data collected during an assessment? A. Ignore the discrepancy and continue as usual. B. Modify the data to make it consistent. C. Report the issue to the BCBA for clarification. D. Stop the assessment immediately. Answer: C. Any data inconsistencies should be reported to the supervising BCBA to ensure accuracy and reliability in the assessment process.